We had 2 minutes, no pulse, 2 lives on the line. And in that moment, everything else stopped, because if we didn't act immediately, we were going to lose them both. It had started like any other shift, nothing unusual. Labor ward was steady, the usual rhythm, voices low, monitors tracing quietly in the background, time moving slowly but predictably. She had been admitted earlier that day, late pregnancy, tired but stable. When I first saw her, she was lying on her side, her partner sitting beside her, holding her hand. They weren't speaking, not much. They didn't need to. There was a quiet understanding between them. I introduced myself, explained I was the anaesthetist on call, that I would be nearby if anything changed. She nodded, calm, trusting. There was nothing obvious, nothing at all, to suggest what was happening underneath. An undiagnosed cardiomyopathy, silent, hidden, waiting. Everything progressed, as expected, observation stable, monitoring reassuring. The room settled into that familiar pattern, predictable, safe, and then something shifted. Not suddenly, just enough to feel it. Before you could explain it, her color changed, slightly, then more, a gray tone, replacing what had been normal. Someone checked her again. Another set of observations, a pause, and then she collapsed. No warning, no gradual decline, just collapse. Her body became still, unresponsive, and in that instant, everything changed. The calm disappeared, replaced by movement, purpose. The emergency buzzer sounded. More people entered, voices sharpened, and then no pulse. That's the moment. Everything narrows, not time slowing, but focus tightening. There is no space for anything else, only what needs to happen. Next, compressions began immediately, hands placed firmly on her chest, arms locked, body weight driving down. Her chest compressed under force, down, release, rhythmic, relentless, each compression forcing circulation where there was none. The sound filled the room, the pressure, the movement, and then a crack, subtle but unmistakable. The ribs giving way. Beneath the force, you feel it, more than hear it, a moment of awareness, and then you continue, because at that point, the ribs don't matter. Circulation matters, oxygen delivery matters, survival matters. I moved to the head of the bed, airway first, oxygen applied. Her face still. Unresponsive, I positioned her, opened the airway, and intubated. The tube passed, cuff inflated. Ventilation confirmed, each breath delivered steadily, controlled. Around me, everything continued, drugs drawn up, adrenaline given, then again, and again. The uterus was displaced, left lateral tilt applied, trying to relieve pressure, trying to improve flow, trying to give us anything, but the monitor remained unchanged. No rhythm, no pulse, and that's when it becomes clear. This isn't just one patient. There are two, and time is running out. Because in this situation, there is a window, a very small window, measured in minutes, often quoted as 4, but in reality, it feels shorter, much shorter. Because every second spent deciding is a second lost. The question isn't whether to act, it's when, and that answer comes quickly. We cannot wait. We have to deliver the baby now, right here, a perimortem caesarean section. No theatre, no transfer, no time. This is happening. Here, immediately, the team shifts, roles change, focus sharpens, compressions continue. They cannot stop. Everything must happen together. The incision is made, fast, through the skin, then deeper, layer by layer. No hesitation, no pause. This is speed, this is survival. Suction fills the room. Blood appears, cleared instantly. The abdomen opens, the uterus exposed. Another incision, decisive, and then the baby is delivered. Small, pale, still, for a moment. Everything pauses. The contrast between urgency and stillness. Then the neonatal team moves, immediate, focused, trying to bring life into something that isn't yet responding. I stay with her, because she still has no pulse. Compressions continue, adrenaline again, ventilation steady, waiting, watching. For something, anything, and then a change, a rhythm, a pulse, faint. Then stronger, return of circulation. You don't celebrate it, you confirm it. Because everything depends on it being real. She has a pulse. 2 lives, still there, and that was the moment I realized. Sometimes everything depends on what you do in just a few minutes. Because sometimes those minutes are all you have.